And welcome back. And we're sitting here talking to Dr. Charles Osgood from Mountain Home Family Chiropractic. Thank you for joining us today.
It's great to be here.
So we were talking a little bit earlier about, you wanted to highlight this time about degenerative disc disease.
Degenerative disc disease. We talk about certain things when we come in and discuss like a topic. We thought we might bring degenerative disc disease up this time because it's one of those topics that really doesn't get talked about a whole lot. In fact, if you say degenerative disc disease, most people don't even know what you're talking about. And it's mainly because people don't really think about the body all that much. You live in your body, but you don't really think about it. But what you have is you have cushions between each of the vertebrae that are like shock absorbers. And so just like a car has shock absorbers and like rubber bushings that keep all of the parts from, like the metal parts from touching one another and really creating damage, well, the discs in your spine are those shock absorbers for your spine, and they keep the pressure from having those vertebrae get to be bone on bone and doing more damage. So if you start to lose those discs, that's called degenerative disc disease. And it's more common than you think. In fact, I would say probably 70 to 80% of people who are over the age of 45 are going to have some form of it. That I see in the office anyway. We take x-rays regularly of people, and we see that very, very commonly. Anytime you're starting to get up over that age, you'll start to see that. And it happens mainly because of old injuries that you've had in the past. But the effects of it can be pretty detrimental, like extensive nerve pain, where you have pain coming down from one area to another, radiating down arms, down legs, sciatica type pain. All of those type of pain are produced from nerve pressure, typically from degenerative disc disease is what we see. So it's something that it's very hard to prevent, especially if you've had some type of an injury to the spine. But there is one of the best preventative measures of degenerative disc disease is if you have been injured, say in your 20s and 30s, is to get chiropractic care to correct the injury. And then if you remain under a maintenance or a wellness adjustment, which is, like say a monthly adjustment just to keep that maintained, you don't see as much incidence of disc degeneration as you would otherwise for someone who'd never had it corrected.
So if somebody gets corrected for this, so what does it actually do, the chiropractic care for that?
Adjustments to the spine where you have a loss of a degeneration of that disc, where it's thinned out. Every time you adjust that spine, you actually will pull apart on that area, and it can rehydrate some of that disc. So each time you're adjusted, you'll draw more fluid.
So you get more cushion.
You get more cushion. You'll actually decompress that disc. And so it will get to where enough decompression occurs that you lose the nerve pressure. And that nerve pressure, when it's lost, you start to get less spasms, less muscle pain, less fatigue of the muscle, less achy, soreness, tiredness of all the muscles. Achy, fatigue, soreness, tiredness, all of those things are usually because there's some dysfunction somewhere occurring when it comes to the nerve function that controls the muscles. If we can remove that dysfunction by making it work properly again, then we can restore that area to better health.
Right. So this isn't a one cure fix all. You'll come in and got that bone on bone rubbing.
Evaluate you, see what you got. X-rays.
Right.
One of the main things that we do. See what you've got going on. See how extensive the disc decay might be, and then come up with a game plan. Because when we adjust you that first time, it will provide you some relief. But you've experienced this.
Yeah, I have too.
It can come right back.
Right.
So it needs to be adjusted a few times in a row in order to be able to overcome the effects of the disc degeneration,
Right.
and to slowly pump that disc back up and get that pressure removed over time.
So you aren't pinching those
So
discs
you're not
together.
pinching them together. And so once we take the x-rays, you'll come in, we'll take x-rays. We'll do a nerve scan, which is a neat little machine that shows you nerve function and how much decrease in function you have because of the disc degeneration. And then we put those two together to give you a game plan as far as what is it going to take to get you where you want to be. And typically when folks first come in, there's so much pain and problem. Where they want to be is just out of pain, you know, and that happens fairly soon within the first few visits.
Mm-hmm.
But then to get to where its stability is occurring, it takes maybe a few weeks to kind of get that to take place.
You know, one thing cool I noticed about that nerve scan you said is with me, we saw that my problem was not where I was actually hurting. You know, not where I was, and you told me, and you said, you know what, here's where your problem starts, right here. Down at the bottom.
Yeah,
and then I'm
radiating up.
And I didn't know that your body will overcompensate on one side. So that's why, like I've got problems on my right shoulder here. It's because I'm overcompensating from my lack of, you know.
Right, from a weakness in one area, you'll overcompensate in another area, and then that will cause that area to spasm up and tighten up, and because your spine wants to remain straight up and down.
Right.
And anytime you have a spasm or a nerve dysfunction that's creating this kind of a situation where you're crooked, then the rest of you is going to overcompensate and bring the rest of your spine straight again so that you're looking straight ahead.
Right.
In doing that, it's just creating all kinds of, you know, twists and turns in there that we've got to kind of untie the muscles, get the knots to kind of calm down, and get everything to relax and get it balanced again. And that's really what we try to do, is get your balance back to the spinal function so that everything's working like it should again. And that's why it can take a few weeks sometimes to get you under control. But, you know, that first visit, exam, x-ray, scan, and everything, is just $37. We make it inexpensive because we don't feel like the diagnostic portion should be where you're spending tons of money.
Right.
We feel like you need to spend your money on your care.
Right.
And so that's what we try to focus on. And then most insurance covers it. Everybody has different plans.
Right.
You know, some people have insurance where it's almost like not having insurance. You have this huge $5,000 deductible, and well, if you have that, then we're able to still design something that you can afford week by week to be able to get you through the treatment, but get you the care that you need. So don't be afraid if you think it might be too expensive or whatever, that you're putting it off because you just don't think you can afford it. Come in and let's see what we can do.
Okay, so if somebody's got like nerve pain or a sharp pain or what, how do they get a hold of you?
Yeah, 425-4424 is the phone number. The website's a great website, mountainhomechiro.com. A lot of good information on what a chiropractor does, what we do in the office, who's in the office. You can even ask me a question if you're not sure if I can help you through an email link on that website. Sign up for an appointment on the website as well. But yeah, if you're experiencing, you know, really severe pain across these areas here, shoulder blades, radiates up the neck, headaches, numbness and tingling in the arms and hands, numbness and tingling in the legs, feet, sciatica type pain where it's shooting down the backs of the legs, all of those type of things are nerve type dysfunctional pain. And so if we can evaluate that by seeing where it's coming from, we'll be able to get it back under control. So give us a call, 425-4424. We can help.
All right.
We'll let you know just exactly what we see and give you a game plan.
Well, sounds good.
Yeah.
Well, Charles, thanks for coming with us today, being on the show.
You bet.
And if you have any questions, please call Dr. Osgood at
425-4424.
what he said. And I'm living proof of it. I had some problems, and we're getting that adjusted, and I feel a lot better.
Yeah,
you know, I didn't think, I was kind of skeptical about it, but I like it.
When you don't know and you've never been,
Right.
and all you've heard is what somebody tells you,
Right.
I've had a lot of folks like that. Well, man, I wish I'd have come years ago. This is great, you know. So it's nothing to definitely be concerned about. It actually feels really good to be adjusted. I get adjusted once a week. It's a great thing to do. So
anyway, thanks for being here.
You betcha.
And this is the end of the show. And thank everyone for being on the show. And we'll see you again next week.